Hey everybody, I just wanted to give an update on how I've been doing so far with the braces. I know I said I promised an update video right around the time that I had my last adjustment, and that was December 21st, but I've been so busy and I just haven't gotten around to it. So I wanted to give an update on how I'm doing so far. As you can see, I'm now wearing the lovely elastics. Aren't they beautiful? I hate these. It has been such an adjustment wearing these elastics. As a matter of fact, I didn't even know that I was getting elastics. I remember I had my appointment at the orthodontist office December 21st. I believe it was about 8:15. So usually what they do, they set up the appointments. They're not really good at really communicating what they're going to be doing for you. When you go to your appointment. So each time I sit in the chair, it's a big surprise. So I had no idea. I remember telling you guys last time that my power chain on my upper arch was completely removed. And now I have a stopper on that, of course. So that was nothing new. But they did remove the silver power chain that I had on my bottom arch. So that is no more. So that is great news. I have a stopper on those teeth as well on my bottom arch, which is great because that means I'm still making progress. So that's all wonderful. So they told me I didn't need those anymore. They put the stoppers on, but they did tell me that they were going to give me elastics. And I'm like, what are elastics and why do I need to wear these? I've seen them on people before that have worn braces. I really didn't understand what they were all about. I did ask the ortho assistant, and she did say that the orthodontist is really trying to fine-tune my bite. So that's why I was giving these wonderful elastics that I'm supposed to wear. It was a huge adjustment to wearing these elastics. Not only did I get the elastics, but keep in mind that I had a new wire change. They gave me a thicker wire. So the wire was removed on my top arch and my bottom arch. And after they did that, they said, well, we're going to give you elastics. Come over and let us show you how to put them on. And I'm like, what's this all about? So it was a huge surprise to me. I had no idea I was getting elastics. For some reason, when I've seen people wearing elastics in the past, I've always seen them wearing them on like their back teeth, on their molars, or for whatever reason, where it wasn't really all that noticeable. They told me that I had to wear my elastics on my teeth here in my upper arch, and it's kind of running from the upper arch downward diagonally to the bottom arch. So this is the configuration that they gave me. It looks ridiculous. I thought that they would be situated more on my back teeth so it wouldn't be so noticeable, but I've got them on my front teeth and I just think it looks crazy. And like I said, the combination between the new wire change and the elastics causing more pressure, because these are heavy elastics, it just was a little bit too much. So the first day that they gave them, I think I wore them probably for about maybe 15 hours and I just couldn't stand the pressure and I took them off. They told me not to. They told me to wear them 24 hours, but I couldn't deal with it, so I took them off and I gave myself a little break. And I put them on the next morning. The same morning, it was the same feeling. I wore them for a couple hours and I took them out. And I just was having so much discomfort for them. I said, let me just give myself a little bit of a, 2-day break from these. And then the third day, it'll be all gung-ho. I'll start wearing them religiously. And that's what I did. I mean, they told me not to do that. And hey, during this process, sometimes you just have to do what you think is right for that time being and deal with the consequences afterwards. And that's what I did. So I got a little bit more religious with wearing them the third day. It's been an adjustment, but I've been hanging in there with them. Now I don't notice them that much anymore because, like I said, I've been wearing them for a couple weeks and I think my teeth have gotten used to the pressure. So it's not that bad. I still hate the configuration of them. There's probably not much that I can do with that until they give me a new configuration on how to wear them. They told me to wear them this way, so that's the best that I've been doing. So I have an appointment at the orthodontist office, I believe, in the next 2 weeks. So I'm gonna determine and see how well, my teeth have been doing and adjusting to the elastics. I have noticed some movement in my bottom arch since I've been wearing the elastics. It's kind of pulling things a little bit closer together, so I guess they're working. I don't know. I mean, I'll get more feedback on that process once I get to the orthodontist office and I can ask him personally. But like I said, I'm dealing with it the best way that I can, and that's probably something important to keep in mind if you're new to wearing braces. Keep in mind that you will have some pain after adjustment. Everybody adjusts differently to pain. It's usually best, at least they say, it's best to take like ibuprofen before you have your appointments, or some Tylenol to help alleviate some of the post soreness that you will feel after your adjustment. Because keep in mind, your teeth have gotten used to a certain level of pressure in between the weeks before you have your adjustment, and a lot of times, you know, they're changing things around. It can cause a little bit more pressure, especially if you get a thicker wire. So keep in mind, you want to try to be as comfortable as you can through this process. You know, it's not the best process to go to, but you want to do what's comfortable and what's right for you and still try to follow their instructions. So I actually was told, they told me this time that I'm going to have a lot of the brackets removed and repositioned, and I don't really understand the reason for that. I guess they're kind of trying to fine-tune things with my teeth a little bit more. So they did tell me to take something before I went to my next adjustment, because like I said, they're going to be removing some of the brackets and I guess repositioning them into better planes of symmetry or something. So basically I'm going to be in more pain. And that's probably the worst thing in this process. I just don't like the discomfort. It takes me a couple days to get used to some of the things that they change in my adjustments. You know, I usually give myself a week to get used to things, and then I kind of feel back to normal. It's not uncommon in this process to have random teeth that hurt, you know, every day. Every day it seems to be a different tooth that's sore or uncomfortable when I try to bite down on it. So it's just trying to get used to those little things. But of course, keep the bigger picture in mind. You're gonna have a great smile after this is all said and done. Your teeth are gonna be better in line. You're gonna better be able to care for your oral hygiene. So there are some positive. It's better to look at the big picture. And each time you go for your adjustment, keep in mind you're one step closer towards your goal of getting your braces off. I just try to have a positive experience through this whole thing. You laugh a little bit, you cry a little bit, but you get through it. And that's basically it. I'm doing great with the process, and I will update you guys on my next adjustment when I go in January. So thanks for watching this channel, and I hope that I've encouraged you guys somewhat. Thanks again. Bye-bye.